Spine 21's mission is to move spine surgery from mechanical implants with no postoperative opportunity for adjustment to a new family of intelligent implants that have the ability to receive and transmit information, to collect information from the patient, to react to data, and to self-adjust or to be remotely adjusted based on wireless technology.
So your smart implants, will they have memory?
Of course.
Will they have computing power?
Of course.
Will they have sensors?
Of course.
Will they be able to communicate?
Of course.
Unbelievably, I'll be brief. I think it's a game-changing technology base. Smart implants will be the winner.
Sometimes when you're involved in developing a new technology, the answer is not only right in front of you, but it may have been first figured out 10 or even 20 years ago. Sometimes looking at technologies that really broke ground a while back, reconceptualizing them, combining them in new ways, you create a true game changer. That is precisely the case, I think, with our first presenter, who happens to be one of my dear friends and one of the most savvy, experienced entrepreneurs in orthopedics, Ron Sacker. So I'd like to now introduce his company, Spine 21, the video that they have prepared for the pitch tonight.
Hello, I'm Ron Sacker, CEO of Premia Spine and Spine 21, and together with my excellent management team in Israel, the United States, and Europe, we're embarking on the development of a family of disruptive spinal implants which can be remotely controlled by the surgeon. We're developing a family of products that include an adjustable cage, an adjustable rod, and an adjustable interspinous device, collectively addressing over a $4 billion market opportunity in the spinal implant market. Spine 21's mission is to move spine surgery from mechanical implants with no postoperative opportunity for adjustment to a new family of intelligent implants that have the ability to receive and transmit information, to collect information from the patient, to react to data, and to self-adjust or to be remotely adjusted based on wireless technology. So how do these devices work? Very simply. Inside each implant is a radio system with a receiver and transmitter. It's operated by a microprocessor and powered by an implantable battery. And there's a micro gear that creates a lifting system which creates the adjustments. We've already proven the technology in a sheep model, demonstrating that the device can be implanted and then weeks later can be adjusted remotely. The device has patents which are already issued in countries throughout the world, including the US, China, Europe, and South America. In summary, Spine 21 has an exciting platform of products which will be disruptive to the spine industry, and a very experienced management team which is capable of taking this technology through commercialization. Thank you for your attention, and feel free to contact me at ronsacker@gmail.com.
Congratulations on an interesting technology. I'm excited to learn a little bit more about it. You mentioned 3 products, and I'm curious if you're developing all 3 of them simultaneously, and if what you see the sequencing being between them if you're not.
So we're focused on developing the platform that could serve multiple products, but we think it's very important to focus on one product initially. Having said that, there's battery technology, there's communication technology that needs to serve all of the products. So as we spec the different products and identify the core requirements from each of the subcomponents, we want to make sure that we don't have to develop multiple iterations of the same component for different applications if possible. And we believe that the growing rod products that are currently in the market don't perform as well as they could or should. And we think that there are intrinsic benefits to our approach to solving this problem, which would make this product superior to the products that are currently in the market.
Thanks for that. And can you tell us a little bit more about the patents and the key claims?
So the patents were filed years ago, and so they're quite broad. They cover different aspects of these different applications, and I believe that it gives us a very, very strong position in the market. Having said that, we want to continue to develop additional claims and additional patents as we keep driving this program forward. Ultimately, we want to create a minefield that's created by virtue of multiple patents, some larger, some smaller, but all designed to make it difficult for followers to try to get into this space.
And in the video, you talked some about the more the functions of the devices, what their capabilities are. Can you maybe describe that a little bit more and why that's important?
First of all, the opportunity to collect information for the patient is important. But I think what's more important is to be able to take that information and provide it either to the practitioner or to the device itself so that action can be taken. I remember when I was looking at going into therapeutics, someone told me, don't go into diagnostics unless you have a therapeutic that comes with it. And so I think that should be the case here. Any information that you're collecting should be actionable. You should be able to take that information and do something with it. If you're just collecting information for the sake of information, there's no value to it. But if we can collect information such as forces on the implant and then communicate that information to a doctor, the doctor can look at that information and decide to bring the patient in. We can identify, for instance, whether a fusion has taken place or not. There's lots of things that can be done with sensors that are in implants and use that information for the benefit of the patient and the caregivers.
Excellent. Thank you, Audrey. Tony?
Ron, Viscogliosi Brothers' heritage has been to invest early in innovation, early even ahead of many others where there's still a lot of risk on the table. It seems like this is that kind of situation. It's very early. There's a very big market opportunity, but a lot of risk still in taking your technology platform. You call it in the video of family. I like that word, given Viscogliosi Brothers is a family office. Could you address what you see as the three largest risks that are before you today and how you'll be mitigating those risks? Thank you.
First of all, I think the biggest risk right now is to identify which is the right first product. And I think that's a significant risk for a company. You can have a great, let's say, platform technology. If you pick the wrong first application, it could be deadly for a company. And so we're spending a lot of time making sure that we're picking the right first product so that we don't have to step back and start over, so to speak, because these startovers are expensive for everyone. I used to believe that there was a very big development risk. Today, I don't believe there's a big development risk. And the main reason is that when we first started looking at this opportunity, and this ties into what Robin was saying earlier, this could have been done, let's say, 15 years ago. The problem was 15 years ago, it would have added $500 to the bill of materials because all these components were so expensive that you could theoretically invent a product like this, but it had no market given its cost. The beauty of what's happening today with communications, with power technology, is that all of these components are found in everyday appliances. And as a result, their costs are extremely low. And so I think that the development risk is very, very low. I think our capabilities and our technical capabilities are superb. So I don't have any doubts as to whether we're able to actually make these products. We've already proven that we can make these types of products. And so I don't have any questions about that today. But if you take me back a few years ago, my main question was, can we make a product like this with a relatively modest additional cost of goods sold so that we actually have a product that could be commercialized and not just made for the sake of making a product. And then the third risk, which I think is the biggest risk, revolves around cyber, and I think that's a very, very big issue today. And we see every day issues around cyber. The last thing that we can afford is having implants that can be hijacked and people that could literally be blackmailed by someone who could control them. So that's going to be a very, very important issue for us. Fortunately, we live in a country that's rich in folks that work in the cyber security area, and we'll be tapping into the right folks that'll make sure to help us build, the most bulletproof product that can withstand, any attempts to try to hijack a product like this and engage in malfeasance.
Well, those are very powerful statements of view of risk. I agree with you too, that cybersecurity in smart implants is a very large risk that needs to be resourced and effectively mitigated. It's not very problematic when you have a few implants. It's problematic when you might have thousands of patients. And I expect that that's what you're shooting for, is thousands and millions of patients. At Viscogliosi Brothers, when we invest in technologies, we have 3 corners of a pyramid that we look at. And one corner is data-driven. Another corner is patient-specific. And the third corner is surgeon-centric. So could you address how you will involve surgeons in the development of your technology?
We come from a very, let's say, clinically driven background. This technology sits within Premia Spine. Premia Spine has been engaged in the development of a facet joint replacement for over a decade. And we've built slowly but surely surgeon support for what we're doing through clinical efforts. We currently have a very large IDE. We're approaching hopefully the end of this IDE process with close to 40 different centers involved in this IDE effort. And I think through the IDE process, we've been able to work very closely with surgeons and gather their support for the technology, because they're involved obviously in the clinical study of this technology.
So I have a couple quick questions, then we're going to move on to our poll. But the first question, and by the way, as I was listening to you talk, Ron, I kept thinking of no wine before it's time. So your smart implants, will they have memory?
Of course.
Will they have computing power?
Of course.
Will they have sensors?
Of course.
Will they be able to communicate?
Of course.
Now, once they do all those things and the data comes to presumably the doctor, first of all, it's kind of like the old saying, ignorance can be bliss. Sometimes you get data first. Do you know what you're getting? Can you understand what the implant is telling you? 2, is it relevant to something that you can even do anything about? And, so let's start with the first one. A lot of what we know about biomechanics comes out of the biomechanics labs, cadaver labs, and the last 30 years of clinicians looking at body parts. But when you have something in motion, actually in real time kicking out data, now you're going to put all those theories to test. It'll be theoretically extremely interesting to see how close that data matches what was in Punjabi's textbook and what was, out of the biomechanics labs. Do you have a feeling right now how close you're going to hew to what we all think is going on with the spine?
So let's take an application like an interlaminar or interspinous device where you want to distract. Well, obviously you're concerned about how much force you put when you distract. So you want the device to be measuring the force to make sure that you're not over distracting and possibly creating an adverse impact on the spinous process. Well, there's an abundance of data on how much force you can put on the spinous process before it starts to crack. So obviously, the system will rely on the science. At the same time, if we see that a certain amount of force creates some adverse event, Well, that information is logged, and now we start to learn. And as we start to learn, we change our parameters. So we'll start with some kind of a baseline, and then we'll be learning from there. And so that's the beauty of this technology, is that we use the existing science, but then we continue to advance the science, and we use big data in order to help inform the implant as to what is good and what may be problematic in the patient.
And what's going to be so fascinating is because we are moving into a data future with artificial intelligence, the reader of that data may in fact be another computer. So, Ron, I just think this is exciting and very interesting, but we have an audience, and audience, what do you think? Now, we've heard some interesting description of the technology. You've heard some reaction from some pretty sophisticated, experienced people. Is Spine 21 a game changer? Is it promising but needs more work? What do you think? And the results are, could challenge the standard of care. 7% thinks it's a winner and a future game changer. Promising but needs more work. Something here, but hard to see. So that's interesting. And actually, I'm going to go back around to our panel and get some thoughts and final comments. And if you don't mind, Tony, I'm now going to start with you, if you don't mind. And so what do you think?
Unbelievably, I'll be brief. I think it's a game-changing technology base. Smart implants will be the winner.
Wonderful. Well said. Thank you. Audrey.
And I have to agree with Tony, you know, the future is device digital combination, and across all kinds of fields of medicine, not just orthopedics. It's clearly where things are headed. You know, there's also a lot of activity in this space. So I'm sure you're well aware of that, Ron. It's getting crowded out there. So time is in some ways unavoidable, but it also can be an enemy. So I just want to wish you the best of luck. I think that this is definitely where technology is headed, and I can see some real patient outcome improvements.
Thank you.
And in my comment, when I was on Wall Street and helping to, bring money to young companies, I focused more on the entrepreneur themselves. I put a lot of, I felt that their track record, they've been through this before, if they've had other startups, even if they've had a failure or two, that moved them up in my estimation. I feel exactly the same about you. I would, if I was going to bet in this field, you're the guy I would put my money on. I don't know if it's going to be a game changer, but I think it'll ultimately be a standard of care. I think smart implants will ultimately be pretty universal. I think the problem of, do you understand the information you're getting? Can you actually use that information? Not solved yet, but if anyone can figure it out, I think, Ron, you're the guy that can do it. Here's how you can reach Ron. So with that, Ron, I want to thank you very much.